Hey everybody, it's Ed O'Keefe and welcome to another episode of America's Leading Dentist. I'm super excited to be here with Dr. Jenny Tran. How are you, Jenny?
I'm great. Thank you. How are you?
I'm awesome. So I know as a practicing dentist, sleep apnea, life-changing interventions. But dental implants is also one of those things that when people get implants and they had dentures that didn't fit well, or they had removable dentures and they had missing teeth and they can't eat the foods that they love, it's pretty life transformational as well.
Yes.
Right? So I guess let's back up. So why did you decide to get advanced training in dental implants so you can help more people?
Yeah. So one of my philosophies is being able to help my patients comprehensively, right? And so when a patient comes to me, I want to be able to look at their mouth as a whole. And so from everything from functionally to aesthetically, like what can I do for you that, restores that for you? And so if you're missing a tooth, which very common to miss a single tooth, it can affect your function first and foremost, but also aesthetically if it's in an aesthetic area. And I felt that there was a very real need to be able to provide that service for patients.
Yeah. I think one misconception that most people don't realize is if you miss a tooth and you don't get it restored with a permanent solution, that bone starts to, how would you describe it? The bone starts to
Shrink. Yeah.
And so when you look at people that are much older, maybe the past generation, and they didn't have the options that are available today, and they have that shrinking jaw, and the older than they are look.
Yes.
That's because they didn't go ahead and get that area replaced with a permanent fixed solution. Am I saying that correctly?
Yeah. You did very well there.
Oh, thanks for not being a dentist, right?
Yeah.
Well, it was funny when I started doing, back when my parents were both still alive, they had dentures. And I remember talking to them about once, I was like, well, tell me everything you don't like about your denture. And they went on for about 15 minutes. They didn't like anything about their dentures. So when patients come in and they got dentures that don't fit well, or maybe they're painful, what are their frustrations, and then what are they saying to you that they desire with dental implants?
Yeah, so one of the biggest complaints is it's very uncomfortable, right? It's bulky. A lot of people, if they're at home, they won't wear it. They'll just keep it out, right?
Keep it out.
Yeah, and so
isn't that something?
Yeah, they'll wear it just to be able to, for aesthetics, like when they're out and about. But even, it's embarrassing sometimes. They'll say that it'll literally move or slip out while they're talking or eating. And so they come and they're like, I want something more permanent. I want something fixed. I don't want something falling out of my mouth or that I have to remove at night. And so that is one of the most common complaints, I would say. Secondly, not being able to eat certain foods, steak, corn on a cob.
Big ones?
Nachos, right?
Oh, wow. You can have nachos? I didn't know that one.
Well, it depends on the case, but if you have some missing teeth, or it's hard to crunch on things, right? Or it's jabbing you in the gums, and
Yeah. Biggest concerns or biggest frustrations or misconceptions I think people have about implants are, when they think of dental implants, they think expensive, right?
Yes.
They think large investment. And sometimes that's come out of, they've gone to an implant center that they've seen on TV, and they've just been given a bulk price that doesn't talk about achieving their short-term goal and while achieving the long-term goal, which we'll talk about in a moment. And so that sticker shock of $30,000, $60,000, and they're expecting you to pay it immediately, can scare a lot of people away. So how have you approached, or how do you guys approach helping people afford dental implants and the investment? Because it's not cheap, but it's also an investment in your future, because all the data is showing that, look, if I can chew foods over a long period of time and I'm eating and getting more nutrients in my body, I potentially can live longer. I can have more longevity, more joy. So it's really about a quality of life thing. Okay.
Yes.
So off my soapbox, how do you address like people being able to afford it? Like, do you guys have financing? Are there different options for people?
Yeah, definitely. We offer financing options, and we work with third party like financial institutes that can help with, creating a loan or whatever to make that more possible, right? Because we understand that it comes as an expense, but it is, like you said, it should be considered an investment, right?
Mm-hmm.
Because it restores your eating function and your aesthetics and quality of life and nutrition and health and all that. And it's a surgery, and it's a prosthetic that's permanently implanted in your mouth to last you for many, many, years.
Yeah.
For sure, decades.
And my understanding is like you can get installment payments just like you would on a vehicle or something else that
Exactly.
you can get low payments over. I mean, I think some of these third-party companies will give 3 to 5 year installments on it, correct?
Yes.
Something like that, right?
Yeah.
Obviously, you got to qualify and go through that.
Yeah, of course.
But the team here at Hedgecock Dental will walk you through that and help you make the decision that's best for you. And so one of the other questions I want to ask you was, that people ask a lot too, is like, well, how painful is it?
So, I don't want to go off and just be like, absolutely no pain kind of thing, but it's not as painful as people think it is, right? I would say that getting a tooth pulled, from experience and what my peers also say, is having your tooth pulled hurts more than getting an implant placed, right? So implants, your jawbone doesn't have the same nerve as a tooth does, and so having an implant, it's a titanium post that gets placed into your bone, and because there's not a lot of vascularity, you don't have the same inflammatory process. That inflammation and that healing is what causes a lot of pain for most people, and so you don't have that same extent when the implant's placed into the bone.
Yeah. Now, there's different kinds of, so folks, what that means is like, it's nothing compared to probably, even though it's a surgery, and I don't know why dentists do this, they post like surgeries of dental implants being placed. It looks way worse than it is. It's like guys post like just pictures of people smiling, maybe we should do that as a profession. My next question is the teeth in a day versus, like, what's the truth about teeth in a day? What's the actuality about that? Because you see a lot of people promoting, like, we can get you a brand new smile in 24 hours. Is that really possible, or how does that work?
Yes, it's totally possible. And how that works is, you come in and you get these implants placed, and so that's 4 to 6 implants, top jaw, bottom jaw, and then you have depending on the type of procedure, but you'll have the prosthesis or the teeth placed that very same day, top and bottom. And so you can leave the office that day or within 24 hours, a full set of teeth, a brand new smile.
Oh my gosh. And then do they come back? Well, when they come back, like in 30 days, you check them and see how they're doing, or how does it work?
Yeah, so after surgery, you want to follow up on your patients, make sure they're doing okay, make sure the healing's going properly. We'll follow up on the implants, see how they're doing. And so the afterwards, of course, it is a major surgery, and so we will follow up with our patients routinely for up to 6 months just to make sure everything's going well.
Wow.
And
so there's a lot of advertising out there. A lot of the implant centers are just pumping out dental implant stuff. Is there any questions, or what would you say to someone out there who maybe they've gotten quoted a big dollar amount, or they didn't feel like that was the right place for them, or they're wondering about, is like, should I come in or not? What would you say to people just to alleviate some of their concerns about coming in for a consult, getting to meet you guys, meet the team, and just realize how warm and friendly this place is?
yeah, so I would say first and foremost, one of my philosophies and all of the philosophies here of the dentists who are here is that we want to educate our patients. Mm-hmm. We want to let you know what's going on, and of course every patient is different, and so come in for a consult. Let's see, what is the problem you're trying to solve, and what can we do for you? And so that is how we like to, have our initial meeting with all of our patients. And then from there, we discuss the options, like this is the best option for you, or based on what you're looking for, these are the options, right?
Yeah.
And so it's...
So they're in control.
Yeah.
Yeah, which I think patients don't feel sometimes. So that's so great that you guys do it that way.
Right, yeah. And so our main focus is understanding the patient's needs and trying to provide the options that's going to suit and solve that need for them.
Yeah.
And then giving them information about how much it's going to cost and what is, the time sequence of like that procedure look like, and, the healing, and answer all the questions that they have about it. And so, and then from there, they have more information, and then they can decide what they like to do. So that's how our process is, and it's meant to, reduce the anxiety about it, have somebody talk to you that is here to listen to you, trying to figure out what your needs are.
Yeah, I love it. I love it. Okay, my last question is, what gets you out of bed? Why are you, I know you're taking more training, you're always learning, you guys are very growth-minded, right? It's been so impressive to be around here and meet so many people of your team. Why do you still practice, and why do you still do what you do?
Yeah, so I've wanted to be a dentist since I was in grade 8.
Oh, wow.
It was a group project on careers, and for some reason dentistry clicked with me, and so I've been on that path ever since. I was like, I'm going to become a dentist, and so I've been doing it for over a decade now. And what gets me out of bed is when I find a solution to the problem that my patients need, and that's what really is inspiring and keeps me fulfilled, is when you're fixing something for somebody that they couldn't do themselves. So because of my knowledge and expertise, and so it's a unique transaction that I know that I get to do for them, and so that's what gets me out of bed.
I love it. So, well, thank you so much for being on the show today. I just want to let everyone know, like, hey, if you want to book an appointment here at Hedgecock Dental, simply there will be a link somewhere around this video or a phone number to just give a quick call to. The people here are amazing, and we'd love to have you in here and get to meet Dr. Jenny Tran and the rest of the team as well. They're just really incredible. So thanks so much for being on the show, and thanks everybody for watching. Hope to see you soon.